Okay, before moving toward the actual topic, that is a cardiac cycle, first we have to discuss some basic things that is related to the pressure volume loop and the cardiac cycle. Okay, so if the contractility of the ventricle is increased, what is the consequence? Increased contractility. Rock,
Yes, please repeat the question. What about contractility?
if I increase the contractility of the left ventricle, what happened? What consequence? What are the changes? What are the result of the increased contractility of the ventricle? What
Ejection
happens?
Well,
fraction will increase.
no,
Okay,
there's going to
so
be if you increase contractility, there could be an impact on the stroke volume as well as end diastolic volume with regards to
okay,
relaxation and how much blood is returned.
okay. So first thing, stroke volume increase, right?
Yes, yes,
Next, someone say that ejection fraction. Yes, ejection fraction is increase.
yes.
I hope you remember the formulas of all these things. Okay. And what about the end stroke volume? If you increasing the contractility, what happened to the end stroke volume?
End stroke
Decreases.
volume,
Decreases.
Yes, end stroke
it
volume
should
decreases, right?
decrease, right? Yes.
So can you name the any drug that increase the contractility of the heart? We already discussed some drugs in the
Digoxin,
previous.
Digoxin.
Digoxin,
Digoxin.
digoxin, sympathomimetic.
yes. There are a lot of drugs. We discussed these drugs in previous session as well. So what is a preload? What is a preload?
The amount of blood that's returned to the ventricle, the
And
left
preload
ventricle.
is mainly determined by which thing?
Come again?
Preload is mainly determined by end diastolic volume.
And diastolic
And
volume.
diastolic, yes.
So end diastolic volume, right?
Yes.
So if you give the IV fluid, what happened to the preload?
Increases.
Increases. Okay, increasing preload, what effect on the stroke volume? So I am thinking about
Increases.
if the subject is healthy, you increasing the preload, what will be the effect on the stroke volume?
Increases.
Increases.
What is this principle?
Wait, you
Frank,
asked what will happen to
Frank
Is it
Starling
the fixed
principle.
Starling's law?
Starling.
Frank Starling's law.
Okay. So if you increasing the aortic pressure or mean arterial pressure, if you increase this, so because there are a lot of question in the USMLE that are arrow questions. They give you some sort of the drugs, give you some conditions, and they ask about the which thing is increased, which thing is decreased, right? That's why I am focusing on these things, right? All as all some of these concepts we already discussed in detail, but these are worth repeating concepts, so that's why I am repeating again and again, right? So the aortic pressure or mean arterial pressure is increased. So first thing, what happened to afterload?
afterload increase?
Okay, so afterload is mainly determined by mean arterial pressure. So
Yes.
afterload is
Increase.
increased. And what happened to the stroke volume?
Stroke volume is decrease.
Because you have to work against higher pressure, higher resistance.
Correct.
So the stroke volume is
Decrease.
decreased, right?
Yes.
And what happened to the end systolic volume? ESV.
Well, it's going to decrease also.
What is end systolic volume?
The amount of blood that is remaining in the heart
In the
after
heart.
After the
contraction.
contraction. So the increase after load means the heart is less able to contract. So it means that higher blood remain in the
Ventricle.
ventricle. So it means that end systolic volume is increased, right?
Yes.
So I'm again repeating the concept. If you increase the aortic pressure, if you increase the mean arterial pressure, so first thing, what happened to the afterload? It increased, right? Afterload
Yes.
is increased. Stroke volume is decreased because heart is work against higher resistance, higher pressure. So stroke volume
Yes.
is decreased. So if stroke volume is decreased, so stroke volume is basically the blood that is ejected by the ventricle during one contraction. So there is an increased amount of the blood that remain in the ventricle. So the end systolic volume will be increased, right?
Yes.
Okay. So anybody has a question regarding these things? Okay. If you increasing the heart rate, what happened to the ventricle filling?
It decreases.
Okay. So increasing heart rate, decreasing the ventricular filling.
Feeling. Yes.
So when ventricle filling is decreased, what will the consequence? What happened to end diastolic volume? It will increase or decrease?
It will decrease.
Decrease.
It will decrease. What happened to the stroke volume?
It should also decrease.
It also decrease. It makes some sense?
Yes.
So I know that this is a high yield question. They give you the example of the tachycardia, or they are asking about the arrows in exam. So what will happen to the
Yes.
ventricle filling? What happened to the end diastolic volume? And what happened to the stroke volume? So I think it's a simple if you understand the basics. Am I right, Rob?
Yes. Yes, it's true. But I do have a question. Can you just complete the story under afterload as to what will happen to end diastolic volume? I know we know that end systolic volume would increase, but what would you say of end diastolic volume?
Okay, so what is the end diastolic volume? Can you end diastolic volume?
Yes, that relates to relaxation of the ventricle for filling the end
Okay, so
diastolic.
and diastolic volume mainly simply meaning preload.
Yes.
Ventricle filling. There are a lot of
Yes.
meaning where the end diastolic volume means simply the filling of the ventricle. So the diastole mean filling of the ventricle. Systole mean the contraction of the ventricle. So end diastolic volume and systolic volume. Uh, diastole mean filling of the ventricle, and systole mean contraction of the ventricle. So if you ask a question, if we increase the mean arterial pressure, what happened to the end
Yes.
diastolic volume? I think it's remain
Yes.
same,
Okay.
right?
Yes. Yes, and that was the reason why I asked that question to repeat, because I've seen it before.
Okay.
Whether it
So
remained the same, whether it increased or decreased.
yes, they ask sometimes the remaining same. The view world and
Okay.
NDMA give you some type of things. Okay. So this is again isovolumetric contraction and isovolumetric relaxation. Okay. So this is again the basic. It is a revision. So basically, so if this is a heart, you understand this is heart. I am not a good in drawing, right? So it's heart.
Okay.
It's my heart, right?
Yes.
So I will change the color. So this is right atrium. This is left atrium. This is right ventricle. And this is left ventricle. So the upper chambers are atria, the lower chambers are the ventricles. So the valve between the right atria and right ventricle is which valve? Tricus.
Tricuspid valve.
Valve between the left atria and left ventricle is which valve?
Mitral.
Mitral or bicuspid valve, right?
Yes.
So the valve that is present between right ventricle and pulmonary artery is which valve?
That's the
Pulmonary valve.
pulmonary valve.
Pulmonary valve, right?
Yes.
And the valve that is present between left ventricle and aorta is aortic valve.
Aortic
Right?
valve. Yes.
Okay.
Yes.
So these tricuspid and mitral valve was also known as a atrioventricle valve, right?
Yes.
And these pulmonary and aortic valve is also known as semi-lunar valve.
Lunar valve. Correct.
Okay. So what is isovolumetric contraction? Although UL and NBME did not ask the question in that way. They asked in the graph that we will discuss after a few minutes. So isovolumetric contraction means volume remain same, but contraction means increase pressure, right?
Yes.
So you say that something is contracted. Let's suppose left ventricle is contracting, but volume is not changed. Why? Why volume is not changed? Ventricle are contracting and volume is remain same. Why? Anybody? It's a simple first year basic physiology.
Okay. Yeah, the question is a bit confusing. Can you?
It's not a confusing. I'm repeating. So I like interactive sessions. So I'm saying that ventricle are in isovolumetric contraction. What happens? Ventricles are contracting, but volume remains same. How volume remains same? If you pushing something or contracting something, it means increase in pressure, change in volume, but volume doesn't change. So why volume doesn't change?
Is it due to the closing of the other valves?
Yes. Ingoing or outgoing valves are closed because here is
Yes.
the mitral valve. This valve is also closed and this aortic valve is closed. So ventricles are act as a closed chamber. Nothing is
Yes.
coming and nothing is out from these closed chambers. Okay. So isovolumetric contraction means volume remains same and but the pressure is increased. So the significant event that takes place in the isovolumetric contraction, which sound takes place in isovolumetric contraction? Which heart sound?
So during contraction, that would be S1. S1 you hear because the
Yes,
mitral.
S1.
Yes,
S1 because
yes.
so normally the closing of the physiologically normally closing of the valve produce sound, right?
Okay.
So
Yes.
in isovolumetric contraction, the S1 sound is produced. And S1 sound is produced by the closure of the which valve?
Mitral valve.
Sorry, I can't hear
Mitral
you.
valve.
No.
Mitral valve.
Mitral
No.
and other valve?
Sorry.
Mitral and other valve?
Mitral and tricuspid.
Okay. Which valve close first? Mitral or tricuspid?
Not sure about that.
I think
Mitral.
tricuspid.
No. Mitral valve closes before the tricuspid valve. And this
Yes.
sometimes this leads to the splitting of S1. right?
Yes.
So mitral, this valve closes first, mitral closes first, after that ficus valve closes. And sometimes you heard S1 splitting because of this phenomena, right?
Yes.
So next concept is the isovolumetric relaxation. So the isovolumetric relaxation, what does mean the isovolumetric relaxation?
It means the ventricles are relaxing to receive blood, and then also there will be closure of the semilunar valves.
Okay. So isovolumetric relaxation is basically uh, the relaxation of the ventricle because closure of the which valves?
The semilunar, that would be the aortic and
Aortic valve.
pulmonary valve.
Aortic and pulmonary.
Pulmonary valve.
So what do you expect? Which heart sound present? Which heart
S2.
sound? S2.
S2.
So which valve closed first in S2?
Aortic.
Aortic.
Aortic. So here is the super high yield concept. We will discuss the condition which lead to the splitting of S2. The splitting of S2 again worth high yield stuff. So the splitting of S2, what is the normal phenomena? Splitting of S2 is basically due to delay closure of the pulmonary valve.
Pulmonary. Yes.
Delay closure of the pulmonary valve. And we will discuss this condition today after in next session. Okay. So we discuss why S2 splitting takes place, why S2 happens, and what is the mechanism of S2, what is the mechanism of S1, and in which phase of the cardiac cycle this takes place. We already know that. Does anybody has a question regarding S1 and S2?
No.
Okay, we will discuss the condition that lead to the splitting of S2. Splitting of S2. Can anybody tell me about the physiological condition in which splitting of S2 is exaggerate, or you heard the splitting of S2? Physiological condition, not pathology.
Inspiration.
Inspiration. Right. We will discuss the mechanism of inspiration. How inspiration lead to the splitting of S2. Right?
Yes.
Yes.
Okay. So I'm going toward the first aid. This first aid is visible to you or not?
No.
Okay, I'm going to share this again. Okay. So this is some different ways to assess the concept of the cardiac cycle. In this curves are high yield, and you found a lot of question on that curve in the USMLE. So wait, I maximize this because this curve. Okay. Okay. So this curve. So there are things labeled at 1, 2, 3, 4, and 5, right? So you noted that this point is this blacks are normal. This black line. So this is and systolic volume, right? This thing. And this one is and diastolic volume. Rock, are you getting this?
Yes.
Okay. So stroke volume is basically and diastolic minus and systolic volume. So this is x-axis and this is y-axis. right?
Correct.
Okay. On y-axis, we have left ventricular pressure. And x-axis, we have a volume, right? So in this one position, what happened to this? Pressure is increased. And what happened to the volume? Increase, decrease, remain same. This area.
Volume remains same.
Volume remains same. So the volume remains same. It not decrease or increase. But the pressure is continuously increased. So pressure is increased and volume is remain same. So what phase of this is what phase of the cardiac cycle?
Isovolumetric contraction.
Isovolumetric contraction. So what happened? Which heart sound present here?
S1.
S1. So USMLE loves to ask questions, this kind of the thing. So these curves, graph, pressure volume loops, pictures, murmurs. So that kind of thing are high yield in USMLE.
Yes.
Okay?
Yes.
So pressure is increased, but volume remains same. So it will produce. So the beginning of this phase, mitral valve closed. Okay, we have shortage of time. Okay. So after that, when the ventricle pressure is increased and it increase more than the aortic pressure, what will happen? What will happen when ventricle are continuously contracted? It means the pressure is increased. What happened when ventricle pressure increase more than aortic pressure? Which valve open?
Aortic valve.
Aortic valve. Right. So it means now is the ejection of the blood take place from ventricle, from left ventricle into the aorta. Right? So this number 2 is labeled as systolic ejection. And it takes place because of the opening of the aortic valve. And why the aortic valve open? Because the ventricle pressure become more than aortic pressure. Right?
Yes.
Okay. So this pressure is continuously increased. Okay. So what happens when the ventricle pressure is decreased as compared to the aortic pressure? I'm asking when ventricle pressure is decreased from the aortic pressure, there is closure of the aortic valve, right? So here the ventricle pressure is increased, and now you that ventricle pressure, because this label as a left ventricle pressure, right?
Yes.
So here is the left ventricle pressure going down, and when it will decrease from the aortic pressure to aortic valve close. So aortic valve closure, in this picture, they highlight the left ventricle. Same thing takes place in the right side of the heart as well. But we are focusing on the left side of the heart, right? So the aortic valve closure and pulmonary valve closure produce which heart sound?
That's S2.
S2, right?
Yes, S2 heart sound.
So the beginning of the isovolumetric relaxation, S2 take place, right? S2 take place. So here you noted that the pressure is continuously going down. But what happened to the volume? It remains same. So what phase of the cardiac cycle is the isovolumetric relaxation? It is the isovolumetric relaxation. And the beginning of the isovolumetric relaxation, what important event take place? Closure of
Aortic valve closure.
And
Mitral.
aortic valve closure mean S2, right?
Yes.
Okay. So After that, this isovolumetric relaxation takes place. So we are, wait, no, okay. Which color is that? Okay, after the isovolumetric relaxation, so mitral valve opens. So the normally valves opening does not produce any significant sound, right?
Right.
Yes.
When the ventricle, when the mitral valve is open, so what happens? The filling of the ventricle takes place, right? So here you noted that
Yes.
from this point, the ventricle volume is less, but with the passage of time, the volume of the ventricle is increased, right? Because filling of the ventricle. Okay, so there are two types of the filling. One is a rapid filling, and this one is a slow filling, reduced filling. So the reduced filling occur just before the closure of the mitral valve, right? So this is this black curve show that the normal pressure, volume, and cardiac cycle, right? So now there is a different condition. Suppose they give you that a patient clinical vignette, and in which they give you the scenario that you are the doctor and you are giving the IV fluid to the patient, right? You are giving the IV fluid of the dead patient. They are asking this question in two forms. One form, they're giving this type of the curve, right? Another, they give you the arrows form, which will increase, which will decrease. Okay. If you're giving the IV fluid, what will increase? What will increase?
Preload.
The
Preload will increase, so your end diastolic volume will go up.
Okay. So if you're giving the IV fluid, the preload is increased and diastolic volume is increased, right?
Increase. Yes. Yes.
So if the preload is increased, so it means and diastolic volume is increased. And diastolic volume is increased, it means stroke volume is increased, right?
Yes.
So what is the formula of the stroke volume? Stroke volume is basically and
Heart rate
diastolic
into
volume
cardiac
minus
output.
and systolic volume,
That's all.
right?
Yes.
Insist.
So this green arrow show that the increased preload, right? So starting from this is and systolic volume,
Systolic.
and this one is and
Diastolic.
diastolic volume. So this is normal. I'm highlighting in black color. So this is normal stroke volume, and this one is stroke volume when you giving the IV fluid. So what will happen to the stroke volume? So you have to identify that this kind of the pressure volume group or curve in the exam. They give you the 4, 5, this kind of the curve. Can you identify this kind of the question?
yeah.
They give you the normal one in some standard color, and then they give you some sort of the different curve. So you have to identify these things on this kind of the loops as well as on arrows question, right?
Yes.
Okay, another scenario we already discussed. When the contractily you are giving, they asking this question by giving the drug. Which drug increase? You giving the digoxin. Like they give you the scenario of the heart failure, in which a heart failure patient, you are giving the ejection fraction of his less. So if ejection fraction is less, what is means systolic or diastolic heart failure?
Systolic.
Systolic heart failure.
And
Yes.
you are giving a drug that increase is contractility, right? So they're asking about the what the effect of this drug, giving you stroke volume, ejection fraction, and systolic volume and diastolic volume, right?
Ejection fraction.
Okay. So which thing increase, which thing will decrease?
Stroke volume increase will ejection fraction will increase, will end systolic volume will decrease.
And
What is the
diastolic
last?
volume mainly remain unchanged. Right? So in diastolic volume mainly changed by IV fluids, preload, right? Okay.
Yeah.
So this orange color.
Why end diastolic volume is not decreased?
Sorry?
Why the end diastolic volume is remains the same? Why it is not decreased? Because
and
the
diastolic
stroke
volume
volume.
and diastolic volume mainly depends on preload. You are not giving the fluid. So you are giving. Okay, so we're discussing about the contractility. So what happened when contractility is increased? What happened? Stroke volume is increased. We already discussed. Stroke volume is increased. Ejection fraction is increased, and stroke volume is decreased. So they are asking these things on the curves, on the loop. So here, what happened? What happened at this point? Decrease and systolic volume, right? So normally it should be here, but it will be decreased, right? So and systolic volume is decreased, right?
Yes.
But and diastolic volume almost same, right? So and diastolic volume remains same and systolic volume is decreased. What happened to the stroke volume? Increase, right?
Increase. Yes.
And as stroke volume is increased, the ejection fraction is also increased. So this orange color loop represent the increased contractility. I hope everyone is clear about this. Rock, Asma.
Yes.
Yes.
Yes, it's clear.
Okay. So now I'm going another thing, afterload. So afterload. What does mean by afterload? We're talking about the afterload. We are talking about the mean arterial pressure. So in which condition the mean arterial pressure is increased? In which condition the arterial pressure is increased? Can anybody tell me? Hypertension.
Chronic hypertension.
Yes, hypertension.
Like
hemorrhaging.
Hemorrhaging.
Aortic
in order to
stenosis.
maintain.
You are clearly right. Aortic stenosis, hypertension. Okay. So if the aortic pressure is increased, what happened to the left ventricle pressure? It will. So another question. They give you the scenario, aortic stenosis. You have to identify. So multi-layered question. USMLE love to ask multi-layered question. Like they give you aortic stenosis, I think syncope, angina, and dyspnea. I think this is a mnemonic. Old age, calcification, bicuspid aortic valve. Right? Aortic stenosis murmur is systolic ejection murmur. Am I right?
Yes.
Yes.
Crescendo, decrescendo murmur, systolic ejection murmur. So,
crescendo, decrescendo.
Yes, we will discuss these things later. Murmur, don't worry about this. Okay, so aortic stenosis mean aortic pressure is increased. What happened to the left ventricle pressure? Increase, decrease, remain same. First question, they give you the
Increased.
right to under it will, sorry,
Increased.
increase, right? So first
Okay.
you have to identify the condition, aortic stenosis, right?
Yes.
Very identify the aortic stenosis scenario in your exam. The next thing is you have to identify what happened to the afterload. Afterload is increased. If afterload is increased, what will happen to the left ventricle pressure? It will increase, right?
Increase. Yes.
So if afterload is increased, what will happen to the stroke volume?
But
It will
stroke volume will
decrease.
decrease. It's
It
going to
will
go down.
decrease because you are
Yes.
working against high
Pressure.
pressure. So the stroke
Yes.
volume is decreased. If the stroke volume is decreased, what happened to the ESV? What happened to stroke volume is decreased and ESV
Will increase.
Increase.
I mean, yes.
Increase.
increase. Okay. So now you have to identify these things on this loop. So this thing represent increase left ventricle pressure. Increase left ventricle pressure. Right?
Yes.
Increase left ventricular pressure. So this represent increase and systolic volume, right? And diastolic volume remain unchanged. So they give you these kind of the things. What happened to the end diastolic volume? It will remain unchanged, decrease, increase, right? So be
Yes.
aware of these things. This is the approach you have to adopt in USML, right? Okay, so this will end diastolic minus and systolic volume. What happened to systolic volume is decreased, right? This thing is decreased. This is normal. When you comparing this thing from the normal, it means the stroke volume is decreased, right? Are you able to identify these kind of the pressure volume loop in your exam? Rock,
Yes.
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 can you rock the exam?
Can we do it? Yeah, we can identify in the exam.
Okay, okay.
I think just to add for some clarity, since you're asking if we can identify one way how, and I think this helps because it used to be very confusing, is when you look at the graph where it shows the end systolic and then the end diastolic, you will see that it's almost like an imaginary shift when you look at it with the different conditions, like where you have like with the
Okay, still are you not clear about these loops?
no, but you're up. You're not even on it. You asked a question if we understand. I said yes, and I was saying the way how I was able to try to help myself to understand because you're right. It can be very confusing.
Yes. Okay. So now we're moving to this portion, and after this
Can
portion, I have to conclude that session, right? So this is
Okay.
again somehow the difficult one, but I base some strong foundation that help you to identify this graph, right?
Yes.
Okay.
Can I just clarify one thing? In the previous pressure volume loop.
Okay. Okay.
Hello.
Wait a minute. I have to.
Can you please go just once? I'll not take much time. I want to confirm the afterload increase. Which are the conditions? That is the aortic stenosis only. No, is there any other condition?
Hypertension.
Hypertension. Okay. Then contractility increases in which all conditions? Can you tell? That is one is you told that it increases in this digoxin. And anything else?
Dobutamine, sympathomimetics. There are multiple drugs that increase the contractility.
Okay. Thank you. Okay. Thank you. Any other condition other than nothing? No.
No, you have to know the drugs. We will discuss these drugs in detail, the mechanism of action of these drugs as well, right? You
Thank you.
need to not
Thank
worry
you.
about these. Okay,
Thank you.
some drugs we discussed in the previous session. The drug decrease preload, like the famous drug that decrease the preload. Anybody, Rock, Asma, can you tell me the
Nitrates. Nitrates.
nitrate?
Okay.
And what is
Nitrate.
in which MI? This is the famous question. In which MI the nitrates are contraindicated?
Which
Right ventricle. Right ventricle, no?
right?
Right ventricle infarct, inferior wall MI, 2-3 AV FST
Yes.
segment elevation. Okay. So
Yes. It's
I'm
in
going to move
ventricle.
toward. Okay. Doc, are you clear about
Thank
your
you.
question?
Yeah, I'm clear. Thank you.
What is your name?
My name is Nivin.
Okay, Neman. So I know the name of the rock because rock is my some sort of friend.
Yeah.
Rock,
Okay.
are you my friend? Rock, can you hear me?
Yeah. Yes, I can hear you now. You are breaking up a little bit. Can you repeat the question, please?
Can anybody repeat the question for Rock?
Yeah, he was telling that you are very friendly with him. Rock is very friendly with him.
I'm telling the people
Oh,
that Rock is my friend.
yeah. Well, you meet, this is a very long journey, you never know when you're gonna need someone. So it's good to be nice
Okay,
to people,
moving toward the discussion again.
Yeah.
So again, this is again the repetition of the cardiac cycle. So you know that how important is the cardiac cycle. So the cardiac cycle is divided into the two things. Ventricle, sorry. So we will divide the cardiac cycle mainly looking on the ventricle. We're not, when we talking about the systole, it means ventricle systole, not atrial systole, right? When we're talking
Yes.
about the diastole, it means ventricle diastole. Diastole means filling of the ventricle, right?
Yes.
And systole means the contraction of the ventricle. Generally, broadly speaking, right? So the ventricle systole begins from the isovolumetric contraction. And we already know that what happened in the isovolumetric contraction. S1 take place, right?
Yes.
At the end of the isovolumetric contraction, there is the waves that we jugular venous pulses. So we also these are also important. So the at the end of the isovolumetric contraction, what happens? C wave take place. So this C wave in JVP, jugular venous pulse, there are three waves in JVP. JVP three waves and two are descents. Two descents, right?
Yes.
So at the isovolumetric contraction, S1 take place at the end of the isovolumetric contraction. C wave takes place. C wave represent
Ventricular contraction.
ventricle contraction, right? Ventricle contraction. Okay. So after the isovolumetric contraction, rapid ejection. So here is the again on y-axis the pressure, and again in this x-axis is the time, right? X-axis has a time. So this is heart sound. This line show the heart sound. This show the ventricle volume, and this is the pressure. So mainly the left ventricle pressure. This one, left ventricle pressure. So what happened in the isovolumetric contraction? The ventricular pressure goes up, but volume remain same. So this is straight line, right?
Yes.
So straight line here, ventricle volume. So at the end of the isovolumetric contraction, what happens? Ventricle pressure becomes more than aortic pressure. So the aortic valve open. So the aortic valve open, then what will happen? Rapid ejection. So in rapid ejection, what will happen? The rapid ejection, what will happen? You noted that what happened to the ventricle volume is continuously decreased. The volume is decreased. So the volume is decreased, right?
Yes.
Because volume is ejected from the ventricle into the aorta, right?
Yes.
Isovolumetric contraction, you looked at, the volume is straight line. And in rapid ejection, the volume of the ventricle is continuously decreased, right?
Yes.
So after the reduced ejection, the volume is again going down, right? Does it make some sense?
Yes.
Yes.
Volume is blood is ejected from the ventricle and moving into the aorta. So the ventricle volume is decreased, right? But pressure
Yes.
is increased. Sorry, okay. So here is a blood is ejected and volume is decreasing, right? So
Yes.
when the aortic pressure, when at aortic valve close, what is the mechanism of the closure of the aortic valve? Can anybody tell me?
When the relaxing of when the ventricular pressure decreases less than the aortic pressure, we just mentioned in the beginning.
Yes. Okay. So at this, there is a flip. This is flip. This flip on. This is known as dicrotic notch. So the blip in the aortic pressure, the flip in the aortic pressure after the closure. So this is the closure, this one, and after the closure, noted that there is a blip. This blip is known as dicrotic notch, right?
Yes.
Okay. So here you noted that this pressure is continuously going down. Which pressure?
Left ventricular.
Left ventricular pressure, right?
Yes.
Okay, so this left ventricular pressure is continuously going down. So in isovolumetric, this is the isovolumetric relaxation phase. So the isovolumetric relaxation phase, what are the main events? What are the main sound that take place in the isovolumetric relaxation?
Yeah. During the relaxation, that's when we have the closure of the semilunar valves.
Okay, so it's
Aortic and
produced.
pulmonary.
So it's produced
S2 sound.
S2 sound, right?
Yeah.
Okay.
Yeah.
So the mechanism of this sound production is again very important, and you have to identify the sound on these kind of the graphs and curves. Okay. Now moving toward the rapid filling. Rapid filling mean rapid filling of ventricle, right? So the rapid filling of the ventricle produce another sound, which is known as
Rapid
S3.
filling as F3. Yes.
S3, right? So S3 is produced in. Can anybody tell me the normal condition in which S3 is produced?
In children, pregnant women, athletes.
Yes,
So
volume overload,
in children,
hyperdynamics.
Yes.
normal physiological causes of S3. Children,
Yeah.
athletes,
Children, also athletes, pregnant women.
pregnancy, right?
Yes.
What are the pathological cause of this S3? S3 pathological cause.
Volume
Yeah,
overload.
when you,
Yes,
yeah,
volume
regurgitation.
overload. Volume overload. So volume overload, maybe it's a mitral regurgitation,
Regurgitation. Yeah.
aortic regurgitation, heart failure, like, and thyrotoxicosis, and many more. Right?
Yes.
Yes.
Okay. So another sound, that is a S4. So S4 is a sound that is produced by the contraction of the atria. When atrium is contracted against hypertrophic ventricle. What are the conditions that leads to hypertrophy of the ventricle?
Pressure overload.
Pressure
Chronic
overload,
hypertension.
pressure overload, aortic stenosis, hypertension,
Old age.
old
Normal.
age, old age, right? So the mechanism of S4, when the atria is contracting against hypertrophic ventricle, and you know the condition of the hypertrophic ventricle, right? What
Yes.
about the Friedreich ataxia? Does Friedreich ataxia lead to the hypertrophy of the ventricle or not?
If what? I didn't get the question.
What?
I am asking a question. Friedreich ataxia. It is a congenital condition. It lead to the
This I think Friedreich ataxia doing dilated cardiomyopathy.
it's lead to hypertrophic cardiomyopathy. So hypertrophic cardiomyopathy means
Support.
eccentric,
Yes, support.
eccentric left ventricle hypertrophy, right?
Yes.
Okay. Wait, I have to scroll down. Okay. So let's move toward the JVP, right atrial pressure, right? JVP and pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure represent which atrial pressure?
Left atrial pressure.
Left atrial pressure. And
Left.
JVP?
Right,
mainly
right atrial. Right atrial.
Mainly right atrial pressure, right?
Yes.
So what are the causes of the increased pulmonary capillary wedge pressure?
You can have, it could be due to like atrial
Anything cause
AFib,
Most
enlargement
important
of
is
the left atrium.
cardiogenic shock.
Yes.
Okay. So the JVP has three wave to descent. So first this A wave. A wave represent the atrial contraction of the
atrium.
And this C wave represents
ventricular contraction.
Ventricular contraction, right?
Yeah. Yes.
Yes.
So ventricle contraction. So if right side ventricle contraction, so tricust valve bulge into the atrium.
Yes.
So next is the X descent, sudden downfall. So this sudden downfall X descent is basically due to the atrial relaxation. Because atrial pressure is suddenly decreased. So atrial relaxation, X descent is represented by atrial relaxation, right?
Yes.
So what are the conditions in which this X descent is absent or reduced?
Well, when
X descents are absent in which condition? X descent are absent in which condition?
Tricuspid
Diastole.
regurg.
Tricuspid regurg and heart failure, mainly right heart failure, right?
Yes.
And what are the conditions that lead to the absence of A wave? Again, a high
Atrial
yield.
fibrillation.
Atrial,
AF.
AFib, atrial fibrillation. Okay. So another wave, V wave. The V wave represents increased right atrial pressure.
Filling. Yeah.
Increased right atrial pressure, V wave.
I
And
have a
last
question.
one is the X descent. Okay, so the last one is the Y descent. So Y descent is basically again the sudden decrease in the right atrial pressure. So blood is emptying from the atrium into the ventricle. So that's why the atrial pressure is decreased. And in which condition this descent is absent? In which condition? Asma, can you tell me the condition?
Cardiac tamponade.
Cardiac tamponade, and it's prominent in the constrictive pericarditis.
Restrictive برضو. See?
Constrictive pericarditis. Okay, so this is the repetition of ECG. So ECG is basically the electrical activity of the heart, right? So the P wave represents depolarization
Atrial contraction of
Oh
atrium.
no. Oh, ECG is electrical
Electrical. This
activity.
is electrical activity. Yes.
And uh, after the
Atrial
electrical activity is
depolarization.
followed by contraction. So it is a
Yes.
atrial depolarization.
Depolarization.
And this QRS complex represents
Ventricular depolarization.
after the QRS, what happened?
Ventricular relaxation.
Repolarization.
After the QRS, ventricle depolarization means. So ventricle depolarization means after the depolarization, ventricle contraction takes place. So the isovolumetric contraction takes place after the QRS, right? They are asking about these kind of things. Okay.
You mean SCT segment? This is isovolumetric relaxation.
Don't confuse this thing from that. I am trying to simply understand the QRS complex means ventricle depolarization. After the ventricle depolarization, what happens? Contraction of ventricle. It's so simple, right? We will discuss these ECG in detail in coming slides.
Okay.
Now I'm giving some overview. Okay, so the T wave represents repolarization.
Ventricular of the ventricle.
Right, ventricle repolarization. Okay, we have shortage of time. So we have to cover these pressure tracing of the jugular venous, right? So it's basically again the repetition. So this is a normal one. This is normal one. In atrial fibrillation, we know that there is no A wave. In atrial fibrillation, absent A wave. In tricuspid regurgitation, this X descent is absent in tricuspid regurgitation. And in constrictive pericarditis, there is prominent Y wave, right? So this is Y. This is normal Y, and here is the very prominent, right?
Yes.
And cardiac tamponade, this Y wave is absent. So you have to identify these pictures and their condition. So first you have to identify the atrial fibrillation. What are atrial fibrillation? Atrial fibrillation presenting things. So the pulse will be irregular in atrial fibrillation, tricuspid regurgitation, constrictive pericarditis, and cardiac tamponade. So we will discuss these pathologies in pathology section. So we have to conclude this session.